case of grade 1 cataract planned for phacoemulsification with the new RayOne EMV lens. Sideport entries are made and viscoelastics is injected into the anterior chamber. Using the 23 gauge 60-tone needle, rhexis is initiated from the center, planning for 5.5 mm to have a good overlap of the IOL for best centration. As you can see, the flap is kept folded at all times as this prevents the runaway of the rhexis. At the last quadrant, the force is directed toward the center to get a circular rhexis as planned. A clear corneal entry is made using the 2.8 mm keratome. Gently after the release of some visco from the anterior chamber, hydrodissection is done and you can see the fluid wave go across and a gentle tap is done in the center of the nucleus and the same is repeated on the other side. Using the phaco probe, loose cortex is cleared and trenching is initiated in phaco 1 mode. Trench of 1.5 width is done so that it is easier as we go deeper. Once the red reflex is seen, trenching is stopped. You can see the various grooves that are being made, so it is important to go to the base of the nucleus and initiate the crack. You can now see the epinucleus plate split and the plate is rotated at 180 degrees and the other crack is completed. Now, going on to the phaco 2 mode, the phaco probe is buried into the center of the nucleus, lifted up and the chop is initiated. Phacoemulsification of the fragments are done using high vacuum. As you can see, there is a good stability of the anterior chamber. The nucleus is broken down into multiple small pieces for easy phacoemulsification. The second hemisphere of the nucleus is gently rotated along the back and then chop is started and it's broken into smaller fragments using the chopper. Since high vacuum is used, there is good stability of the anterior chamber and also good followability of the fragments. In the split screen, you can see the external view of the surgical procedure. You can use the second instrument to guide the nucleus fragments towards the probe. The vacuum is being reduced during emulsification of the last piece. In the split screen, you can see the same steps being recorded from the outside. Now, the bimanual irrigation aspiration is done. The irrigation hand is kept stable, but the aspiration goes around in a circular manner, trying to catch the anterior margin of the cortical fibers, which makes it easier to bring to the center and aspirate. The aspiration is in linear mode under the surgeon control. The subincisional cortex is also aspirated by just turning the wrist to get a good angulation. The anterior chamber should be maintained to push the PC back. At last, the cortical fibers on the PC are also aspirated gently with the port facing upwards. PC polishing is done, which helps in better visual outcomes and reduces the incidence of PCO. This lens has a unique patented lock and roll technology for consistent delivery. It rolls the lens to under half its size before injection. It is consistent and the delivery is smooth. It reduces the insertion forces. The fully enclosed cartridge with no lens handling reduces the risk of lens damage and minimizes the chance of contamination. You can now see the lens being injected under irrigation through a 2.2 mm incision. You can also appreciate the smooth delivery of the lens.
Only went inside, huh?
The RayOne EMV is designed with the aspheric anterior surface and unique inner optic zone which induces controlled positive spherical aberration to extended depth of field without compromising the visual acuity under low light conditions. The RayOne EMV lens uniquely extends a patient's range of vision with a patented non-diffractive optic profile, enabling the depth of field of many presbyopic correcting IOLs. At 1 month post-op, visual acuity and refractive data showed excellent results. It has superior intermediate vision when compared with standard monofocals and fully preloaded across the entire power range. The wounds are hydrated and you can see the post-op picture after 4 hours. This is the visual acuity at 1 week review.